Have you ever thought about the difference of cash pay physical therapy versus insurance based? Having done physical therapy for over 17 years, I'm going to dive into the 8 top reasons I feel like would be beneficial to pursue cash pay versus insurance. Now, there's a reason and or a place of time why you would pursue one versus the other. But in this case, I want to give you the highlights of what I personally have experienced over the years working in multiple settings and what has been the most beneficial to each client and patient. So let's dive right in. The first one is going to be the no insurance limitations. When we think about insurance limitations, everyone's got a different plan on what they cover, how many sessions as far as number of visits they'll cover, also the diagnosis code and saying this is what you're going to physical therapy for, this is what we're going to actually treat. So many times you're limited on rigid protocols. So they're very strict depending on, again, your plan. And again, it could be whether you're going to go see someone in network versus out of network, but also more so the point of, is it someone that you get to choose? Because a lot of times people don't have the option to choose who they go see. Now, in theory, it sounds great because I've been paying for insurance. So my assumption is I'm going to get stuck or put in the position to place someone who's educated because they've got a licensed therapist. And yes, there's a ton of qualified, great physical therapists out there that didn't go to school, not learn anything. They're very educated people. It's just a system that they get stuck in. And that's where a lot of people don't either understand it or they experience it firsthand whenever they go and they get to see the full picture of their actual treatment. So if you've never actually been through physical therapy, it's something that you should probably ask around just because you can get general reviews from other friends, other families, or just in general online of people's experiences with it. That being said, personalized care. Therapists are able to individualize people's treatment programs, or it's more actually advantageous to do cash pay because now it's more tailored toward you. So for example, if you're working or going to physical therapy, going to clinic, and depending on, again, the setup, majority of clinics may either, as an initial, because of the legality of the rules, is have the physical therapist do the initial eval, and then it gets handed off to a tech, or it gets handed off maybe to someone else who may not be as well qualified, or just in general doesn't have maybe the educational piece or experience in that case. Now, we all have to start somewhere. That's where I started. But at the end of the day, too, if you're going for your trust in what's the best protocol for you moving forward, whether it's speed of getting there and or the actual outcome, then you want to consider this as a main factor too of your actual personalized care. Whereas cash-based physical therapist, again, going back and looking at these no insurance limitations, we're not going to dictate saying, oh, you can only come these many sessions. Now, as a cash-pay therapist, I've got to be really good also at saying, this is what it's taken me from experience getting other people to the result you're looking for, meaning the number of sessions. And that way I can tailor it to what you're looking for and I can be specific with you versus being distracted because I'm having to work with 3 or 4 other people at once, and thus the quality of care goes down. Or again, you're not getting to work with that licensed person. So that's the big benefit of actually going to cash pay because you get to go directly to the person you're going to be working with, but you also get to know that you're not limited in your care. And this is what a lot of people are seeking, is they want to know that they're going to physical therapy for them, not to be treated by the insurance. Number 2 is quality and time of care. So leads right into, what do the visits look like? So as cash pay physical therapists, we can spend more time. We're not limited. It's our discretion on what is best for you. So collaboratively, we want a win-win situation where it's great for us, but also great for you. If we don't get you the result, well, how much business are we actually going to get over a period of time? So we have an incentive to actually give you the best care, but also tailor it to your needs. Again, when you're doing the insurance-based practice, you may be stuck with 3 or 4 other clients at the same time. The attention span gets distracted and or you're not maybe working with the therapist himself. So your actual care is limited. Not saying that they're not qualified people, the therapist, but it's just, again, the system that they're stuck in. So it also gives us that advantage of doing more hands-on. Just case scenario, recently, probably within the last few years, I had basically, and this was through out of network, but it was a client who was doing this through one of their insurance groups. And we were able to submit what's called super bill, like the codes. And so the insurance comes back and says, you cannot bill more than 2 codes, which codes are just ways of saying, what did I do within a 15-minute increment? So this was manual therapy hands-on. They said I could not do more than 30 minutes. So, sorry, it was actually more than 15 minutes on this one. I've had it before, they said more than 30, but this one was actually 15 minutes. So going back to it is saying, okay, well, how is the insurance going to dictate what you're needing that day, the quality of care, but also saying what they're going to cover? So as a cash pay therapist, I may say, this person comes in this day, They need manual therapy, which is not an adjustment, but it's a way to realign the joints to get the muscles back into place to activate to do their job. How is insurance company going to know what exactly that person needs in that certain time or that day that they come in? Whereas they just determine one size fits all hat and says, no, whatever session they ever come in for, they can only have one unit of that. Well, at the end of the day, that's just not how the body works. And that's what you're going to get when you go through insurance. So it does limit your standard of care whenever you go through insurance. Even though in your mind you think you're getting the best care, reality is you're just checking the box saying, hey, I've got insurance, I'm going to go try to use this. But it's just going to be this game that you're going to constantly play of, am I really getting the best care? And this is what I need in this moment in time. Third part is faster progress. And I've noticed that hand over time. The most standard protocol for most people who get a script for physical therapy is going to be said, go see the physical therapist 2 to 3 times a week for 4 to 6 weeks. No matter what the issue is, what the injury or diagnosis, people get the same protocol. For the most part, a lot of the physicians are just leaving it up to the therapist to get an educated opinion on what it's going to take. So that being said, most PT clinics, just because of knowing the situation and the system and how it works, the limited time you're going to be there, the limited time you're going to work with a therapist, it's going to take you that much longer to even try to get even a third of the result that you're looking for. Whereas cash pay, because we're not limited on what we're looking at or addressing, we can go in there really quickly, address multiple areas of the body a lot faster, thus give you a faster result. And that's where it's great to see this, because especially in my practice where I work with a lot of business professionals, we know that they're either in a need of getting in or out of discomfort, a need to get back to the gym or being active, or just in their business, they need that focus, that clarity, productivity. They don't need these whatever discretionary pains, aches to linger on 2, 3, or 4 months down the road, then to not even be addressed, fully fixed in the first place. No, with cash pay, we know, okay, we're going to get right to it. We're going to address this person's needs. And it's all about speed, meaning not that we're going to rush through it, but we can do more in a quicker amount of time with less visits. So overall, reality is you're not taking off time of work as much. You're not spending a lot of your time out chasing certain maybe sessions rather that is going to not be the best benefit to you. And so it also delays the healing, because there's a time and place that the body needs certain things to be addressed in a speedy manner. So when you're doing it through cash pay, again, you're going to get the best result because you're doing this in a lot faster manner than you would going through insurance. So there's a lot of things that can be tailored to you as the client when you're doing this. But again, when it's through insurance, you're kind of stuck with, not in a bad way, everyone else. So it's like you're going to play the game of time. And then unfortunately, the injury, the pain, the sleepless nights, the pain medication, all the other ancillary stuff that comes with it, you're going to have to deal with. Fourth part, cost transparency. So here was an annoying thing I always had to deal with when I worked in insurance. A lot of times people don't tell you that, especially if you're in network. They're going to say, well, you just have to pay your copay. Reality is no one really knows at the end of the day what insurance is going to reimburse. So every clinic, for the most part, is going to charge a high amount of number. So if you haven't met your deductible in the first place, some of the clinics I worked at could be $300 to $500 just for one eval. And that was just with them talking with them for 30 minutes. Nothing actually happened in transaction, whether it's manual therapy, hands-on, any kind of exercise. So this person's deductible, if they hadn't met it, could blow right through it. All of a sudden, you get a back-end bill from the insurance saying, hey, you owe us money, even though your mindset was going there paying maybe a copay, a deductible, whatever it was, 20, 30, 40 bucks. At the end of the day, you're never going to get a straight answer because no one knows. And that's just because the insurance never tells us. And so when you're doing insurance-based stuff, it's a very conflicting, confusing, crazy game. So insurance versus cash pay. Cash pay is going to be straight up and says, hey, this is the amount of time. Roughly, you're here for an hour. This so many sessions. Everyone's got a little bit different program, the way they run it. I usually do off package deals, meaning I have a really good idea of how many sessions are going to take after I see someone's pattern that I've already pre-framed, meaning they come in for the assessment. I base it off their hand dominance pattern. I can see where the rotations, the restrictions are. I know from experience of over 17 years, work with people, what it's going to take after seeing all the ancillary things, questions I ask them to understand, hey, this is where this person's at in their time in life, what they're dealing with, what matters the most to them, and how fast we can get there. This is what I can recommend to you. Here's how many sessions it's going to take. So you're not playing the game. You're not sitting here trying to guess, okay, how long does this look? You have a better idea versus insurance because, again, the limited or lack of quality of care that you're going to get because of the way the system is set up, this thing could go on for a long time. Thus, that's why a lot of people may extend what the result is and or have to have multiple surgeries down the road because all of a sudden nothing ever got fixed. So they're having to chase this symptom until it's no longer a symptom they can deal with and surgery is necessary. So cash pay, cost transparency, you know what you're getting. It's not a guessing game. And my business professionals love that because they just want an answer. People want an answer. They want the truth. They don't want to play games, right? Convenience and flexibility, number 6. This is big because, again, going back to, do I need to go spend time to go to the doctor? Again, nothing against the doctor. They're great people. They're smart, but they're busy. So sometimes it may take you a couple weeks even to get in and or the time to wait to get in and just the whole game of taking off work, going to do this. So at the end of the day, you go see a therapist, get direct access, and or, depending on the situation, there may be some cases where you have really an injury that you really need to deal with the doctor or maybe some imaging, stuff like that. But majority of times in the cash pay setting, most of my clients, they're not hurt. They just have some discomfort, some mobility issues. They just want to move better, meaning they want to go work out without that discomfort. They want to go run, want to go lift weights, or just in general, they want to feel better. So it's not really like they're injured. And that's why a lot of people don't pursue physical therapy in the first place, is because they think physical therapy is only for someone who is injured. At the end of the day, being in a cash pay practice really focuses on mobility. We're looking at how does the actually body align? How does it actually function with the muscles and how you're trying to utilize them in your workouts or your day-to-day activity. So you're not sitting here trying to, always deal with an injury when you're coming in for physical therapy. Maybe just be more of an alignment issue. Maybe you're just trying to get more in tune with your body and you want your body to go to work for you. And that's the power of cash pay therapy, which on the next one is when we talk about is more on encouraging preventative care. It flows in because now we can go beyond. And so this is what I love about the cash pay is you can now really help people see a broader view, learn about their body. They may be dealing with blood pressure issues, blood sugar levels, limited sleep, their diet, exercise, and you're not going to do, so you may have a short period of time you can talk about that in the cash pay. But at the end of the day, this is a holistic practice. When people are coming in to see me, we're looking at everything from their cardiovascular system, the musculoskeletal system, their nervous system, how things play together. We also want to know about their diet. Are there any things that they have questions on that's going to influence their inflammation, which limits their healing productivity, the recovery aspect of it, or just in general how their muscles function, to how their blood pressure, their blood sugar levels, how things may offset, different systems in the body, the organs, but also their quality of sleep, all the way down to their hormone levels. And some people are getting specific too, when we're even looking at having them get their genetic test. So very big into the biohacking space where we'll go into and seek, what is it this person actually can get the best benefit, the best result, because that's what they're here for. They're coming not just for the discomfort, the pain, the tightness, or whatever their diagnosis is or the issue that they're dealing with. And usually it's never just one thing. And that's the very limiting fact about when you go through insurance is everyone's given a diagnosis, which is reasonable because insurance needs that code to bill, but it's also never just one thing. There's multiple things going on. So that's why you never really get anything fixed that you want to get fixed, because if you just address one thing, let's just say, well, my shoulder's hurting. Well, you go get your shoulder. No matter how good they do at stretching your shoulder out, maybe going through exercises and strengthening, if you never really look at the underlying issue, which could be your pelvis being offset due to your hand dominance pattern, throwing off the rib cage, which throws off the shoulder blade, which then throws off the alignment of your rotator cuff. No matter how well you do at opening up that shoulder joint and then strengthening around it, which will never be truly possible because things aren't lined up. So you're not truly connected with your nervous system. So it's a false positive. At the end of the day, you're just going in there and stretching a tight muscle. Someone perceives feeling better. They also go through the modalities, either heat or cold or stim, to trick the nervous system. So all of a sudden, you never fixed anything. You just temporarily put a Band-Aid on it and went on with your day. So if you never look at the other areas that are surrounding that lead to the actual issue of why it occurred in the first place, then you're just kind of in a way putting a Band-Aid on it and waiting for something to happen down the road. And that's why people never get the result that they're looking for. And that's why it gets a bad status, meaning they don't feel like it was really worth their time. Again, not against the therapist or someone doing it, because they're very educated people. It's just the system and the insurance company that tries to tell you how to do your therapy and live your life is saying, hey, we can only treat one area of your body, not look at a full body approach. And thus we're very limited on what we can get. So it's never the result outcome that you're looking for. And the last, second to last, is the improved patient therapy relationship, meaning you get to invest more in yourself, because this is a huge part. When we're looking at actually doing something, no matter what it is in life, if you don't put any effort into it, meaning you don't invest your money, your time, your energy into it, less likely you're ever going to really truly get the most out of it. Because a lot of times we are kind of just creatures of habit, meaning when something's given to us for free, we don't really value it. And not saying that insurance base is free, but at the end of the day, if our insurance is covering it, and or we don't really feel like it's just something that's a priority, or something like, oh, I'll just miss this session, I'll come next time, or whatever it is. No, this one, people are paying for it. Where you pay attention. And so this is a very strong concept, and a very congruent, meaning a very true one, that when people pay, they actually pay attention. And so it's one of those that they invest more time, more energy, more effort, and you always see the outcome, you see the result. Personally, again, done this for 17 years, even longer, before, working with clients, doing training, you'd really see the outcome of the people who invested in themselves were the ones who got the best outcome. And that's what the last one leads me to on number 8, is the result you're looking for. When it comes down to it, no matter how many sessions it takes, whether it's 5, 8, 12, 1, at the end of the day, all you're looking for is the result, right? You're not trying to sit there and be like, oh, well, the doctor said I need it 12, or whoever said you need it 12. And so your mentality is like, the more I go, the better it's going to be. That's not really the case. I mean, you can go 12 or 20 or 30 visits, whatever it is, if the insurance will even allow it, because that's the crazy game of it. Some insurance company will say, oh, this, we allow you 30 visits. Another one says, we'll give you 6. And so, for the same thing. And so at the end of the day, it's really the result that you're looking for. Why is it that you're pursuing this? Is it an injury? Is it something of pain or discomfort? What is it that you're actually looking for? So whether it took 1 visit, 5 visits, 8, the goal is not to sit there and just have you come just to come. That's just a waste of your time and a waste of money. And so at the end of the day, the goal is to get you the result. And when you do it through cash pay, you have such a faster result, but also a better outcome, meaning, is it going to be something that you continue to chase over a period of time? Really the goal for us is to educate them on why it's going on, what they can do to address it, but how to maintain. Because at the end of the day, if we go in there and just fix it, just like I was talking about earlier about the shoulder example, make you feel better. Well, if I don't leave you with a game plan moving forward, then nature's going to happen where our hand dominance pattern is going to pull us back into that locked in position. And before we know it, we're back in the same boat, meaning things are tight, it's not feeling good. So you need to be educated on why you're doing it, why it's occurring, but also how to avoid it from happening in the near future. If this is something that you've been dealing with, and or you're really curious about cash pay physical therapy versus insurance based, reach us to us here at Human Function Performance. We can help answer questions, or if you're in the Dallas area, work with a lot of different conditions. But everyone's coming in for different reasons. So it's a main thing that a lot of people may not think about, especially where the healthcare system is going, is to really look at cash pay versus insurance. The mindset is always, well, I've got insurance, I need to use my insurance. And I get that, you're not trying to waste money, but at the end of the day, health insurance is really just there for trauma and or really, I would say, like more medical conditions where someone's very sick, having to get a lot of appointments, go to the doctor a lot, get medications. Is not set up, unfortunately, to take really your health care, meaning your plan of action. It'll keep you from continuing to be sick, so you can go home and survive, kind of survival mode, but it's never going to be the best. And especially if you're one of those that you're tired of avoiding, or you're tired of going through the roundabout of getting sent to one session or one doctor or one treatment here, and you're just going all over the place, and it just seems like an exhausting, in which I'll hear this over and over from clients, just so exhausting because you're just spinning your wheels trying to get the treatment, but it's so limiting because of the way the insurance works. But no, you just want to get this done. You want to get it taken care of. Well, that's where you look at investing in yourself. And that's where cash pay physical therapy comes into play. Again, it doesn't always mean that you have to be injured. It just means that you have something you're dealing with. You want to get better. You want to speed up the ball game, and you want to get the best result that you can, so that you can continue to live an overall functional life. Feel better, move better, and perform better here at Human Function and Performance.